Okay, so it will record from my end, so I don't know who else wants to record.
Oh, but now she's dropped out.
Oh, dear me.
No, I'm still here. I'm still here.
Oh, you're still there.
She's
Oh, okay,
I
that's
just
fine.
closed
Good.
because I'm trying to pick up my charger for the phone in case you need to
Okay, that's fine.
send me a side note.
All right. Good evening, everyone, and thank you for joining us at SmartVersity Book Club. This is the book club that is unique, that brings something that will add value to your life, that will bring growth to your life. So SmartVersity, basically, it's a book club where we promote the culture of reading. And we believe that it's through reading that we can sustain ourselves to be informed with valuable knowledge. So we read, we review different kinds of books. So it's a diversity of books, and we go beyond. Whenever we have a unique subject that we need to look at, we call experts to come and discuss with us. So today we have an expert who will have a conversation with us on mental health awareness. So at SmartVersity Book Club, we don't ask our members or anyone belonging to the book club to pay something. Our core purpose is just to deliver value and impact lives. And at the end, we want to see that we inspire growth. So at this moment, let me just set some ground rules before I hand over this meeting to Brother Jonathan Sikombe. So at this moment, the ground rules, rule number one, is that this meeting is being recorded and it's live on Facebook. So by joining this meeting, we believe that you have consented that you are part of this meeting. And rule number two, just mute your mic and your video unless it is necessary for you to switch on your video. But the mic, let it remain on until you are allowed to do so, or you want you will get more details from Jonathan, who is going to moderate this conversation. And I want to mention that when it's time for the questions, make it brief and short. Jonathan will guide us more. And I want to mention as well that be polite in your comments or asking any question. I'm just here just to introduce, because I'm the admin of and the founder of SmartVersity Book Club. I am your host, Ali Kingston Wheeler, and I'm handing over now to Jonathan Sikombe, who is leading us into this conversation with our guest this evening. Jonathan Sikombe, good evening.
Good evening. It's a pleasure for me to host this meeting today. I was asked to host this meeting and sort of guide the interview with Dr. Maria Akani. Just as a bit of an introduction, Dr. Maria Akani is a TEDx speaker. She's a life coach, she's a psychologist, she's a psychiatrist, and an internal optimist. She's also a mental health consultant with a wealth of experience in clinical practice, both in public and private facilities. In terms of education, she studied a Master of Medicine in Psychiatry and a Master of Science in Clinical Neuropsychology. And she holds a degree in Medicine and Surgery, the MBCHP, and also a degree in Human Biology, the Bachelor of Science in Human Biology. She also has, on top of that, a certificate in life coaching and Christian counseling. She's got vast experience and education, as I've explained, that has enabled her to be an enthusiastic teacher, facilitator, speaker, and delivering lectures and talks at various subjects pertaining to life and living. She has written several articles, and she's a published author, and she'll give us more details about her authorship and everything about her life. But for now, suffice to say that in 2019, she was given the Anakazi Banking Women of the Year Health Award for the various contributions that she's made in advancing mental health in Zambia. This is something that she's very passionate about. So at the moment, she runs a private practice called Renaissance in Lusaka, Zambia, where she resides. Renaissance specializes in psychotherapy, counseling, child coaching, and play therapy, and a host of other things that are related to mental health. So, Maria, welcome. It's a pleasure to welcome you to SmartVersity Book Club. I just want you to give us a bit of an introduction about yourself. Tell us who Maria Akani is. Oh, something I haven't mentioned. Oh, you're muted.
Sorry about that. I was saying you just did. You just gave a very elaborate introduction of me. So I was saying that, first of all, I appreciate that you called me Maria, because that's who I am. Before anything else, that's what I'm familiar with. So I think you have introduced me. Maybe the other things I can talk about is just stuff that's outside profession. The fact that I really enjoy parenting, for example. And I'm one of those people who really focuses on lifestyle and responsible living. So one of my new things is that I'm now what is called a flexitarian, which is basically a person who eats a plant-based diet. Like 80% of their diet is plant-based. And so that's something I'm doing now in order to promote health and wellness. Like I said, I'm really focused on making sure that health, like a healthy lifestyle, is something I look after. So I make sure that I monitor things like how much I've been sleeping. If I haven't been sleeping enough, I monitor how many hours I actually sleep, how much rest, the amount of exercise I do. I make sure I monitor whether I have the 30 minutes recommended exercises per day and things like that. And I love to read. I read a lot of books. And now I have discovered that I can do both audio and the traditional book that I hold in my hand. So I like to do that as well. And then I'm a very curious person, curious in conversation, curious about things around me. Yeah, I think that's it.
Okay, so now after you qualified and got your medical degree, why psychiatry? Out of all the things that you've done, cardiology, pediatrician, that kind of thing, why psychiatry?
So interestingly, I think it was a little bit by accident, because when I was in my secondary school, I used to want to be a doctor, but I only knew as far as obstetrician and like being an obstetrician, being a pediatrician, and those are the two things I looked out for. And then on the side, I really liked to talk to people and listen to people's problems and things like that. And I didn't realize that that was something that was some kind of a gift. I thought it was just an interest and something I just did. And so when I finished my grade 12, I actually went to study Christian counseling. I did a certificate course in Christian counseling at what is now called Evangelical University, and went to school. But it was like, this is the side thing, not necessarily that this is the main thing. So then I went to school, and then I started studying whatever I was studying, my medicine. And in doing my medicine and doing the rotations, I realized that, look, I really do not like the smell of the placenta. I cannot stay here all my life, doing this. And then aside from that, I did enjoy pediatrics.
Yeah.
But at the time I was doing pediatrics, I think there was so much HIV. It was really depressing to try and do anything around that time. So eventually I went to 6th year. And when I went to 6th year, that's when you do psychiatry. And then I was so amazed that this thing that I've been interested in called counseling and whatnot, this is what it looks like in medicine, and there is a place for it. So I really feel that psychiatry is the confluence of my passion, of my interest, and my calling. So yeah, that's why psychiatry.
So when you think about it, and when we talk about mental health, it's easier to understand anything else, like, physical health. If somebody's cut themselves, right? For example, if I cut myself with a knife, I'm bleeding, I know exactly how to measure how severe that is and whether I need to go to the hospital. If there's a car accident, I know how to check whether it was just whiplash or it's something more serious, and then I know where to get help from. But when you talk about mental health, it's, even for me who's done some studies in different areas, It's something that looks like a mysterious sort of field. How would you explain to a layman like me how would you explain mental health to a layman like me for me to understand what it is, how I can measure what it is about, how I can assess it, and how I can seek help for that?
Okay. So one of the interesting things about us, I want you to think about it in terms of all those things you were talking about are they're like an envelope. So the envelope
Yes.
gets injured, okay? So whiplash is about the external stuff, the stuff that contains you inside.
Yeah.
Mental health is everything to do with the actual person inside. And when you look at it, I think the best way to think about it is in terms of what does the brain do, because the brain essentially is what controls what deals with mental health. And so we know that the brain controls how we think, how we feel, and how we act. Okay, so those are the important aspects when we're talking about what mental health is. And when you look at how a person thinks, feels, and acts, essentially it's who you are. Like, there is a way you think, Jonathan. There is a way you feel about things, and there is a way you act, okay? So that is like who you are. So mental health is really you, the person that you are. And then there are additional functions that the brain has, such as controlling the biological functions, our breathing, our heart rate, what the gut does, and things like that. That is one of the reasons why when your mental health is messed up, other parts of the body are affected, like your appetite, your sleep. You may have diarrhea and all those. You may have problems with pains in the body, backache, and things like that, all those things. So when you think about it, everything that makes you a person is what is mental health. And when that is wrong, that's when you see things like a person is not walking properly, because that's what makes you. You know how I walk. If I'm just not walking the way I walk, then there's something wrong. A person is not talking properly. A person is not making sound decisions. Everything is regulated by that. I don't know if that makes sense.
Okay, maybe try and explain this to me. I need to understand certain terminologies, right? How do I say this? How do I differentiate something that I would call a mental illness, a mental condition, or a mental disease? Maybe that might clear up what I'm trying to think, because we don't understand what these things are. When somebody's having challenges, for example, if somebody's having mood swings, somebody's struggling with stress, I'm struggling to sleep, all those things, how do I say this is an illness, or this is just a condition, or this is just a phase I'm going through in life?
So condition is a non-specific term, really. People just use it for anything. To say, I have a heart condition, doesn't really say whether I have a pacemaker or I have an enlarged heart or anything. So condition is non-specific. I think it's a filler word a lot of people use when they can't define something. We don't refer to disease when we're talking about mental illness, because disease is primarily used for infections. Okay.
Okay, right.
So we use the word disorder or illness to signify that something is not working right. I like the word disorder because I think it just explains that something is malfunctioning. Okay. Now, how you said at the end of the day, how do we tell that somebody is just having mood swings, or they're just having they're having an illness and things like that? The truth is, whenever a person is having mood swings, their mental health is affected. What makes it a disorder is the degree to which it is affected and the degree to which a person can regulate or bounce back once those things happen. If you receive bad news, if you've lost someone dear to you, your mental health is not okay. You do have a problem with your mental health. Do you have an illness or a disorder? Not necessarily. What determines that is how you then deal with whatever grief you're dealing with. If you're able to deal with that grief, bounce back, use the resources that are around, either your social support, your core beliefs, and whatever resources that you can use to recover your religious beliefs, then that's okay. You went through a bad patch, and then that's it. But if you now fail to come out of that, despite some of those resources, or you lack those resources, you will probably end up with a disorder that requires professional intervention. So I want you to think about it in terms of a continuum, like a number line, okay? If this is well, this is a disorder, and then there's a lot that happens in between. So if things are happening to you, you are moving closer to this. You experience grief, heartbreak, death, and so on. But if they are too much and you're failing to bounce back, you know, because normally when you're here, you should be able to bounce back. Some positivity, some talking to friends, some exercise, whatever. But if you're failing to bounce back, then you're moving closer to this. You require professional help and intervention to come out of that.
Okay, in your dealing with different kinds of people in your field, what are some of the common misconceptions that you've come across regarding mental health?
Well, one of the common ones, especially in Zambia, is that it's as a result of demon possession.
Okay.
So yeah, and for me, as a physician and as a scientist, I see how the symptoms make sense with the function of the organ. When you have something wrong with your nose, the nose is responsible for mucus, mucus comes out. If there's something wrong with your eye is responsible for tearing, tears come out, or blurring of vision because it's supposed to see. If it's your tummy, you have diarrhea. If it's your brain, it affects all those functions we talk about, how you think, how you feel, how you act, including how you perceive. So one of the things I think that's really difficult for people to conceptualize is, how is it that a person is hearing a voice when no one is speaking? Or seeing a vision when no one is actually there? So one of the things is that, remember that our bodies, like the brain, is responsible for perception, okay? The way I hear a sound is that a sound comes to my ear and vibrations come, and then they stimulate the hearing center. Then I interpret the sound, okay? That's how I'm able to hear you. But if there is a malfunction with that center, it can be overstimulated even when there's no sound. Or it can actually, a person may just not attend even when they're hearing a sound. So some of the things you see is that when a person has a severe disorder, they may not respond to even being called by their name. Because the stimulation is a problem. Or they will be overstimulated. Somebody's calling me, when nobody is calling them. So all those are functions that are done by the brain that now have a problem.
In terms of the causes of some of those issues, the challenges that people face like that, would you say, you know, in terms of, you know, physical health, a number of times they say most of what we, you know, the challenges that we face, probably some research says even up to 95% is either caused by, or actually worsened by, even the food that we eat. Is there something that indicates that the environment might have something to do with our mental health status, or where we find ourselves mentally?
I think, sorry, are you done with asking your question?
The second part will be, how much of those challenges can be related to genes?
Okay, maybe I'll start with that one.
Yeah.
So just like any other condition, there are things that we have genetic predisposition to. So there are things like hypertension. Hypertension runs in your family, which means the likelihood of you getting hypertension is high. But that does not mean you will get hypertension. Sometimes with things like exercise and lifestyle, you might be able to actually not get hypertension at all. But for some people, even with those things, they will still end up with hypertension. The same happens with mental illnesses as well. There are people who are predisposed to things like depression or schizophrenia and things like that. if you don't have what we call a precipitating event, it may not happen in your life. But if, for example, at the age of 19, you lose your mom, and you get married, at the end of 28, you lose your spouse, and then you lose your job in unknown circumstances, you can see that there's so many things that are now pushing against the person's fabric of resistance or resilience. And so that can compromise somebody's mental health. I want to say that even if somebody may not have genetic predisposition, tragedies like that happening, multiple of them at the same time, can compromise one's function. Because remember what I said about the brain and how it regulates everything, okay? So when you get, it's like, I think I was doing this when I was showing you. You get a blow. Maybe before you recover, you get another blow. And then before you get another blow, it's just difficult, because even if you do have resources around you, like your religious beliefs or your friends and the financial support you need, if everything is demanding everything at the same time, you run out of the resource you need to recover. So it can compromise that. And then at the end of the day, your brain controls all the functions of the body, okay? So if your nutrition is compromised, resource has to be taken to look at your physical health. That also means that if you have stress, there's less resource for you to bounce back because of that, because it's the same bank of resource. So if you have an illness, a chronic illness, the likelihood of you getting a mental illness is also higher, because resource has been diverted from your mental faculties to deal with that. That's one of the reasons why when someone is sick, we put them on bed rest. And people sometimes, oh, what is this? Because the body needs to stop thinking and doing whatever, so that all the energy can be focused on healing and recovery. And the person who is like that will most likely spend a lot of time sleeping, because the brain is conserving its energy to focus on the healing and recovery. I hope I've answered your question.
Yes, you have. So what are some of the preventative measures that somebody can do in terms of, doing some self-care? Are there certain things that people can do? Like, for example, if somebody thinks, I might need to take care of myself, or try and prevent something that, or for example, they might look forward and think, I might be going through a stressful situation going forward. What sort of things can they do in terms of self-care to try and be preventative, for situations like that? How can they take care of themselves beforehand? What sort of things can they do?
So we call that building resilience. Like, what can you do to build resilience so that if hardships come, you're able to withstand those things? So what we now focus on is what we call the 8 dimensions of wellness, focusing on the 8 dimensions of your life, because we realize that every one of those areas draws some of your mental energy. And if they're not taken care of, compromise can come from one place or the other. So one of them, for example, is your financial wellness. I think this is a known fact. A lot of people, when their finances are compromised, they can have stress and whatnot. And we know what finances also do for us. They also give us the ability to look after our physical wellness. So physical wellness is another thing. So chronic illness and all those things can compromise your mental health as well. So you have to make sure that, you are looking after your health in terms of your sleep, your eating, and exercise, the water you drink, the substances you take that can compromise your health, like alcohol and drugs and things like that. And then we're also talking about your social wellness. So your social support. And we know that when social support is compromised, either by a death of someone close to us, a breakup of one kind or the other, that can also compromise our health. But what you need to do is make sure that you have a few people who are your social support, people who you can talk to, people who will love you, people who still boost your self-esteem, despite whatever difficult situations you can go through. I don't know whether I should go through all the 8 dimensions, but anyway, one of the others is You think I should? Okay. The other is
touch on a few more of those.
okay.
Yeah.
So one of the others is the spiritual aspect. A lot of studies have shown that people who have deep-seated beliefs actually are able to go through adversity better than those who don't. Then we have environmental wellness as well. And that's why now there's a lot of talk about things like aromatherapy, ambience, because there's a way in which things like that can actually relax you and reduce your anxiety. But if you're in a noisy place, a dirty place, and things like that, it can compromise your well-being. And then there's also things like your goals. What do we call this? Vocation.
Yeah.
So in terms of where you want to go and so on. So just your goals and what you want to do, how those things can keep you alive. You find sometimes somebody is on the point of dying and they'll say, no, I can't die. I have to see my child grow up, or I have to finish this, because there's a way it builds your resistance for you to go forward. Yeah. And then there's also the issue of your profession, work, occupational wellness. So work as well has been seen to be something that has caused a lot of stress. And it's also something that can also help build somebody's wellness as well. So all those aspects are very important. And so it's not possible to have 100% everywhere, but if you have something everywhere, it will help you rather than you only focus on, we can't put all our eggs in one basket. If that thing crumbles, then you have no other place to get your cushion from.
And have you noticed any gender-specific or age-specific mental health challenges?
Yes, there are a number. So with children, we usually have some kind of disorders, what we call childhood disorders, like attention deficit hyperkinetic disorder. Yeah. We have autism, which is diagnosed when children are young. Then we also have developmental disorders as well. Then for males, more than females, you have a lot of substance use disorders. So you find more substance use disorders. And for whatever reason, I think the stats eventually even out later, but we see more schizophrenia in younger males than women. So in around 18, 20, you see a lot more schizophrenia. Then when it comes to depressive disorders, you see more of those in women than men.
Okay. And in terms of issues of past trauma, I think it's come up quite a lot in these days, where you talk about things that have happened to people in the past, some traumatic events, something happened that might have caused the person to be, like disturbed in the way their peace is. It's like they lost their peace because of certain things that happened in their lives. How is it possible for somebody to recover from trauma?
So one of the reasons why I do this job is because I really believe that people can recover from anything. And I have seen that. I have seen people have the most traumatic experiences that are unbelievable, and they have been able to recover from them. So I think that with trauma, there are two aspects. So the way trauma has been portrayed in the world, it's as if it's the worst thing ever. And I need to clarify when I say that. I need to clarify when I say that. Of course, trauma is not nice, but depending on how it is handled, when a person experiences trauma, they then gain resilience. Okay?
Right.
So you find that people who have been through different traumatic experiences, received the support and recovered, end up being stronger personalities, more resilient, and can deal with adversities more than other people. So the key thing is what happens when the trauma happens. If the person does not receive the kind of healing they need or the kind of support they need, then that becomes a problem, because then they heal in a fractured way. In my book, How Can I Make the Pain Go Away? I think one of the things I was explaining was just that. Like if you, for example, have fractured you have a burn on your arm, okay? if you go to the hospital and it's healed from there, it will heal properly. You'll be able to use your hand. Maybe there will even be some skin grafting, and that's it. But if you don't heal in the right environment where there is love and support and whatnot, you may end up with what they call a contracture. So you heal with complications.
Yeah.
And healing with complications is what we see when we see people are bitter, people are have anger management issues, because then they just come up with negative conclusions like, life is unfair, so I have to fight for myself, or people are horrible, so I have to close off myself, and things like that.
I need to ask you this. In terms of, if, for example, I'm dealing with a situation where I've got a mental health challenge, right? Or I see somebody who's close to me. At what point how do I say this is severe enough for me to seek a professional? Is there such a thing where you say, okay, this is manageable within, like us laymen, we can handle this thing? Or is there a point at which I can say, no, this challenge I have myself is not, it's not improving the quality of life of people around me? How can I make that sort of decision in terms of severity of what I'm struggling with, such that I can seek a professional?
There are two aspects that we have to look at: intensity and duration.
Okay.
So if it's very intense and you can see that you're probably not going to sleep, you can't focus on something else, it's very intense, whatever has happened, then you need support. Now, the support you may need, depending on how intense it is, may be just your friends or peers, or it may actually be professional support. I don't know how many of your friends can help you sleep if you're not able to sleep, but those are some of the things that you are able to see, okay? For sometimes people just need to talk out something, then they're able to sleep. I also talked about duration, because if something is disturbing you, a day or two, you can see that you're disturbed. Okay, then third day, okay, that's good. And I did talk about the intensity. So I'm talking about low intensity. Yeah. Something is not disrupting your work or your relationships or your sleep or your appetite and whatnot. And so it's low intensity. Or it is affecting your appetite, but it's not like you're starving. Then you continue like that. You talk to a friend, nothing is happening. Or even if you don't talk to a friend, but you continue in that path for over 2 weeks, then you need to get support. Yeah, and again, the first line of support is ideally your friends. But if you don't have those friends, then you go to professional support. Because I know that sometimes even our friends, they're not like the best friends. They just,
And how do I protect myself? I'm trying to place myself in this. I mean, I'm asking on behalf of somebody, but I'm saying, how do I protect myself from potential judgment regarding mental health challenges? So, for example, if somebody opens up, a lady opens up to their husband, a husband opens up to their wife, or a parent opens up to their child, or somebody as an employee opens up to their boss, there might be that fear, like there's a risk of you losing, something, somebody might say they might not rely on you, or they might look at you in a bit of a different way. How do I protect myself from that kind of stigma in terms of, after I've shared my challenges?
Well, the bad news is that you can't really control that. People are entitled to their opinions and beliefs, so you can't really get into someone's mind and try to tell them, look, don't judge me, or look, this happens to everyone. But I want to believe that conversations like the ones we're having now make a difference, because I think that sometimes we have spooked out what it is to have a mental illness. So we think about it in terms of something that strikes you like lightning, rather than something you could slowly be progressing to because of different things compromised in your life. I always like to say that for as long as you have a brain, you're at risk of getting a mental illness. I think that perks up a number of ears, because then you realize that there's a body organ that controls who you are as a person, and that could malfunction. And it's a very scary thing. Can you imagine? I mean, who you are is like your very essence of life and living. And if that can be compromised, that's very scary.
Yeah. You know why I asked you that question? It brings to mind Elon Musk, right? For example, he shared that he's got Asperger's, right? And he joked about it. And I felt like the way it was received being in the US and the way it would be received in other places was probably different. And I'm thinking, that's the first thing I thought about. It was like, he could easily talk about, he's got this thing. Secondly, I thought about it, was like, this guy is probably the richest man in the world, but he's on the spectrum. And I start wondering whether we would look at things the same way in different environments, whether we're not, the stigma is not stronger in certain places, or I don't know whether the issue of stigma is not stronger in our environments here.
It's definitely stronger in our environment. I'll tell you that it wasn't always like that even in the US. I think it's a lot of conversations around things like mental health and them coming from a very liberal environment that has allowed them to have those kinds of conversations. Zambia and a lot of African countries are very traditional, and we love our traditions. I think they're great, but that limits a lot of thinking beyond what is existent. And I'll tell you, for as long as we cannot explain anything in Zambia, it is witchcraft. So I remember times when we were growing up and we would go to, like, we used to do mission trips when I was a student. And if you take a picture of someone, because they can't understand how you can take a picture and then their image appears here, they would say, you've taken their spirit. So don't let people take pictures of you because they're taking part of your spirit. You understand? So the idea that, okay, explain to me, how is it that a person is hearing something that is not there? You know what I mean? So it must be spiritual. So unfortunately, this has been the explanation for everything. If there is immunization, why are people doing that and getting blood? They're getting blood for satanism. Why are people doing that? And we need to move from that level of suspicion because obviously it kills us in one way or the other. So these conversations are very important. And I think that we're moving to a very different place. 10 years ago, when I decided I was going to become a psychiatrist, I remember speaking to one of my classmates, and I said to them that I'm going to do psychiatry. And I said to them, I'm going to change the face of psychiatry in Zambia. And then she just said, it will change you. And this is like a doctor. And up to now, we still have stigma, even in the medical field. If as a person who has a mental health disorder, if I have bipolar, for example, and it is known that I have bipolar, if I go to the clinic and say that I have a heart problem, the first thing they want to know is, have you been taking your meds? Sometimes they won't even look at my heart. They're just thinking about the fact that if this person has this condition, send them to Chainama. Then Chainama can investigate. But Chainama doesn't have cardiologists. So really, and that's not the reason why I've come. My mental illness is under control. I'm taking meds. Focus on the symptom that I've come with. So you find that even among the mental health professionals, there's stigma. And stigma is still there, even in the US and other places. It's just becoming less and less of it as people realize what mental illness is and also the risk that you stand. So you want to create an environment which will also work for you if something like that happened to you.
So, you're talking about these cultural barriers to good mental health. How good mental health care, right? How can we overcome some of these cultural barriers? How can that change? How can we change the culture of how we talk about these issues?
I think it also has to start from the stigma around certain things, like what we say about people who have need support because they have experienced a bereavement, that they are weak. I also lost my mother. Why is that one acting like that? So we need to change those kinds of perspectives because, like I say, and these things have to change in more than one place. For example, in the workplace, if I have a cold, I can go to the hospital and the doctor can actually write me 2 days off. But if I'm having marital conflict and I'm not sleeping, like who's going to write me a day off? You understand? But that is compromising my thinking and my judgment more than the cold. Okay. So we need to come to a point where we realize that those things are important as well. And the place where we can look at mental health on the same level as physical health, because compromised mental health does lead to death. Some of it is direct, somebody may kill themselves, but some of it is indirect. We've had people who they say, oh, that one died of depression. And we know what that means. They were slowly dying and giving up on life. And we saw them wasting away until they died. And the doctor checked, there was really nothing wrong with them, but they were dying and they eventually died. Yeah.
Would you say the economy has an impact on the general mental health of people?
It does. It does on a number of aspects. Firstly, poverty has been linked to a lot of mental health stress. So already that, stress we know is a something that precipitates mental health illnesses in one way or the other. But apart from that, I think that it changes how we look at life. So for example, we were talking about making important lifestyle choices, okay?
Yeah.
I'm talking about making healthy choices, like eating a plant-based diet. Yeah. But if I've been poor and now I have money, are you kidding me? I want the top soup, the one with the fat just on top. I want butter this thick on my bread. I want sugar to remain at the bottom of my cup when I drink tea. I want vitumbua, a number of them. And if I've put on weight, that's a sign that I'm living well because I grew up thinking like that. And then it also becomes too much of a luxury to start telling somebody you have to think about your sleep, you have to reduce your alcohol, you have to think, because alcohol is probably the only relaxation that I'm doing. I don't have the luxury of going to movies or going to the picnics and whatnot like you do to relax. For me, it's the bar, which is right next, and sometimes my friends get me around. So I think it compromises a number of health decisions that you could make because now you're like in survival mode. I hope it makes sense.
Yes, it does. So in terms of interventions, I want you to try and help us with how these different sets of people and organizations can help. How can family help a person who's struggling with mental health issues? How can friends help? How can churches help? And how can government help? How can companies help?
Okay, so maybe we should start with families first.
Yes.
I think families tend to be in a lot of denial. The other day, I had a conversation with someone who called me and said, I don't know what to do about my family. My brother is clearly depressed. And I took him to a psychiatrist, and now they say I hate him, that I don't love him, I've never even supported him, and I don't know what's best for him. And they literally pulled that person and told them, stop taking medications, this thing is not helping you. And this is a person whose life has deteriorated. They already lost their job. They are malfunctioning for some time. So you can see that this person needs an intervention. So as families, I think that this shame we have because someone has a mental illness, we need to deal with it. It's not a reflection on you. It's a person's choice sometimes because they've been involved with substance use, but sometimes it's nothing to do with that. They just have had a lot of hammers in their life or different things that have led to this space, but deal with it. Like that's one of the important things, and have conversations about it. You find that people don't even want to say certain things. It's like a secret that people don't talk about. And with friends, one of the challenges I find is that, you can even see that there's something wrong, and people will be talking around, hey, have you seen how she's lost weight? She hasn't Congole. And then they don't do anything about it. You know what I mean? Like,
Yeah.
Even if you're not going to sort out the debt, at least start the conversation, because sometimes it's very hard for the person to have the conversation themselves. But even if they don't want to have the conversation, be around so that when they do want to talk, like people talk to the nearest person. That's why, you know, sometimes you're on a bus with someone and they'll tell you their whole life problems just there. They've found someone to talk to who is listening. And this is a perfect stranger. And they'll tell, I keep talking about people who work in the salons, how they are counselors, because people share all their marital problems and whatnot, because you just want somebody to listen. But if you're not around, then you won't be able to give that support. But also remember, like I said, it could be you. So just think about how you can support. How would you like to be treated? Would you like to be ignored? Would you like, sometimes what people need is just, can I help you pick up the kids from school? You know, can I just sit with you? Just those kinds of things, and that's important. And
can I give you a place to sleep?
Yes, you know, sometimes that's what people need. Can I give you a place to sleep? Can I help you write applications? I know that there's an opening at this place for a job. Can I help you sit down with your debt and let's talk about how we can make a plan for your debt? Your drinking is concerning. And, you know, you can't just ignore, we can't just ignore it because last time you had an accident, the other time you were beaten, you know, you're going into debt because of your drinking. So having those conversations is very important, and not ignoring people.
And on the side of the church,
in terms of, yes,
how
go ahead.
can we help? You know, like I go to a church. How can we help when somebody's going through that sort of thing?
Stop trying to cast out devils from everyone who's depressed. Because a number of times the prescription is the same: deliverance and fasting. Okay? But that's not what happens all the time. One of my favorite examples in scripture about a person who suffered from a lot of distress to the point that he wanted to die is Elijah. You know, Elijah had been dealing with the prophets of Baal. At first, he was feeling so intimidated by these prophets and whatnot. And then he had this glorious moment. And that's why sometimes moments after success can be very stressful, because they still draw on a lot of our emotions and everything. And then, you know, he had fire come down. I mean, God showed himself. That was a very victorious moment. He slew the prophets of Baal. And then after that, like, it's a very victorious moment. Then Jezebel says, I want to kill you. And he runs away, okay? So he runs away. He gets to the desert. He's tired. He's hungry. Then he says, I want to die. But if he really wanted to die, he would have just stayed there with Jezebel. You know, Jezebel would have killed him. You get my point. And that's one of the reasons why, you know, I've heard people who say things like, oh, if you want to kill yourself, just go. You would have done it already. Why are you even talking? You understand that the truth is that people don't even want to kill themselves. They just want an alternative. If you can show them an alternative, they will take it. So when you look at Elijah, you will notice that the way he was treated in that moment, the psychological first aid he was given was, first, his physical needs were met. He was fed, he had some shade, and then afterwards, there was a conversation. And the conversation was a still small voice. It wasn't something aggressive and whatnot. And sometimes that's what we need, you know, meeting someone's physical needs, being present, just doing the basic thing. That's basic support, first level support. That's something anybody can do. You don't need to go to training to do something like that.
Okay.
And then when it comes to companies, so I think that it's just also starting with things like policies, conversations about it, building workplaces that have what we call psychological safety, checking that the environment at work is not stressful. There's no things like workplace bullying or sexual harassment that would cause actually people to experience a lot of stress.
Okay. So we'll be opening it up for any questions. If anybody wants to ask any questions, you can either just unmute yourself and indicate that you want to ask a question, or you can type in the chat, then I'll be able to read out your question there. But just give us the last bit about government, how it can help. I know there was a law that was enacted, the Mental Health Act in 2019. I don't know if it was replacing the Mental Disorders Act, that Cap 305. So that is the written law, right? Is that enough to help, or does government need to do more, or have you seen some changes that have happened since that happened?
It's not enough, but it's a step in the right direction. And one of the things that the government is mandated to do is to set up a mental health council, which has not been set. One of the things that the Mental Health Council would do is to regulate the mental health space, and also establish the minimum standard of mental health care that should be in primary healthcare settings, which is important. So the problem with not having a mental health council is that nobody is in charge of mental health. It's like there's no responsible person. So even if the government says that they want mental health to be part of primary health care, which is what they have been saying for some time now, there's no one making sure that it's happening. So it's good that we have that law because there's a premise on which somebody can act, but we need to move a step further and make sure that, mental health services are provided in the same places that physical health services are provided, because we're talking about holistic health.
Okay. There's a question here. Somebody's asking, how about music? Does music help?
So there's what is called music therapy, and music does help. That's one of the reasons why I was talking about environmental wellness, and I was talking about things like ambience, things like scents, things that stimulate the senses. So when you think about music as well, because you notice that certain music would depress people, certain music will agitate people, people just be dancing as if, they're headless chickens, and then certain music will just bring a certain calm. So music does something to our emotions, and it does help. It cannot treat a mental health disorder, but it can be what is called complementary therapy or adjunct therapy.
Okay, somebody here is appreciating you. They say, thank you very much for the talk, very enlightening. Can you just explain whether the correlation between physical fitness and mental health?
Okay. I assume that you joined later. I did mention when I was talking about how the different aspects of wellness actually are related to mental health, because you notice that, for example, you actually need good mental health to participate in physical fitness. You need focus, you need discipline. But then the other way around as well, that good physical fitness will help you with your mental health, because apart from that, it will improve your physical health, which in the end will help you with your mental health. But whenever you exercise, you have the naturally produced antidepressants in the body called endorphins that help to elevate your mood and reduce anxiety. They also improve sleep. Exercise also improves sleep, which plays a very vital role in calming down a person, in recovery, in dealing with mental health and depression.
And also the same person is asking, is there a correlation between mental health and diet?
And diet?
Yeah.
Yes, because also that is physical health that we're talking about.
And then the person says, being someone who wants to try the pescatarian diet, how readily available are the alternatives? How manageable is it economically? And how easy was it to let go of meat? In what ways has this diet helped you? And why would you recommend it?
Okay, so I have an essay of it. So firstly, it's called the flexitarian diet. So it's not pescatarian, because pescatarian is the one that is fish centered. Right. So why I moved to that diet, I noticed that I was, first of all, one of my motivations was weight loss. I've been working on managing my weight for years now. That's something I constantly deal with because I tend to gain weight very easily. But when I did start the diet, I noticed that I was more energetic because I noticed that when I eat meat, especially red meat, I feel like I need to recover from eating. Like after I eat, I have this sunken sluggishness and slow feeling that was just not helpful. So when I started the diet, I noticed I felt lighter, I felt more clarity, more focused, and that's how come I decided to pursue that diet. Has it been easy? Yes, actually, and I'm being honest because I thought I would struggle with it. I think the idea that I'm going to, so the way I do it is that I eat vegetables throughout the week and I only eat meat on Saturday and Sunday. I thought I would sit there like just waiting for Saturday, but sometimes I even forget on Saturday that, oh, today is the day I can eat meat, you know. And the weeks have been shorter than I imagined. I thought they would be very, very long. The options have been there. If you're Zambian, beans is plenty. Unfortunately for me, I hate beans. I went to boarding school, so I don't like beans. So that has been difficult because, you know, beans is the first thing people think about. But I'm flexitarian, so I'm not vegan. So I'm able to have cheese. I'm able to have eggs. I'm able to have chikanda. So when I want to have unshima, I'm able to eat my super roller with vegetables and chikanda and make gravy and able to eat that. I don't think those are difficult options to come across. I love groundnuts. My snacks are lots of peanuts, and there are lots of different nuts now that you can find in Zambia. You have cashew nuts and whatnot, and then you can make other experiments as well on things like chickpeas and lentils, etc., etc. I've come to find that vegetables are actually a lot more flavorful than I've thought before. I used to think they were very blunt, but ever since I became flexitarian, I really appreciate the taste of vegetables.
All right.
Somebody here, Kalumbu,
Sorry,
is asking.
Mr. Jonathan,
okay.
sorry.
Ali, you can come through.
Okay, just a moment. I just thought to cut you so that we can pick from her Facebook page. There are 14 people. They just dropped. There were a number of people who joined.
Yes.
So there is Ndi Mwalukwe Mbuela. The person is saying good evening. And then there is Biden Haven. For some time he posted good evening. Do you feel the Mental Health Act is comprehensive in protecting the mental health patients? Let me read the next one as well, where you will combine when responding. There is another one from Aposa Zulu. He say, good evening, doc. Does anxiety cause acid reflux? So you can combine these questions. Someone is asking whether the act is comprehensive in protecting mental health patients. And then the next one is, does anxiety cause acid reflux? Here you have the questions, doctor. That is from your Facebook page. Thank you.
Thank you so much. So I think I've already answered the question about the Mental Health Act. So I will just proceed to acid reflux. I was mentioning about how mental health also, like our brain also regulates bodily functions. And it's an important aspect to note that if your mental health is messed up, for lack of a better word, you are likely to compromise other bodily functions. So having acid reflux is very related to stress. Some people don't experience acid reflux, they experience other things. But yes, acid reflux is very related to stress. Sometimes it's just bad diet and things like that, but it's very related to stress. And that's one of the reasons why you find that people who have acid reflux, people ask them what else is going on in your life. Maybe you need to work on your stress management.
Okay. There's a question here from Kalumbu, who he asked the question. He says, how do you know who to see when you need to see a professional? Is it a psychologist, a psychotherapist, a therapist, a shrink, a psychosocial counselor, or a life coach? Maybe you tick, in your case, you tick off all those.
Yes,
So who do you see
sometimes
for
you
what?
need to see all of them, actually. That's true. Sometimes I'm serious. Sometimes you need to see all of them. So if you're having challenges with navigating life, so you need to make some decisions, you need to refine your thoughts about things, then you need to see a life coach, because a life coach will not treat you. A life coach will ask you questions and help you to gain clarity about where you want to go and what you want to do, okay? If you are at a point where you have stress and it's overwhelming you, okay, and you have tried to talk to your friends in one way or the other, but you're now reaching a point where your function is compromised, you are either feeling demotivated about life, you're crying a lot, not focused, and so on, you need to see a psychotherapist or a counselor, okay? And so you can also see a clinical psychologist at that point. Any of those, I think, would work well. For more severe, so a psychosocial counselor and a counselor is more for social problems. So if you have like conflict, whatnot, you can focus on that. If you are now at a point where you have like anxiety and you're failing to sleep, you're having panic attacks, and you're having depressive episodes where you're not sleeping, you're not eating or whatever, you definitely need to see a clinical psychologist. The clinical psychologist may be able to tell you whether you need to see a psychiatrist. Now, I was saying sometimes you need to see all three, because sometimes the problems are severe that you're not sleeping, for example. If you do not sleep for more than 2 days, you will start hallucinating. You start hearing voices, seeing visions, and you have perceptual problems because the brain needs to shut down at some point. So you need to see a psychiatrist who will give you medication to help you sleep. And also, if it's panic attacks and things like, you need to see a psychiatrist, okay? If you're suicidal, you need to see a psychiatrist. So the issue is that the times when you need to see a psychologist as well is that the psychiatrist will give you medication to deal with the symptoms. The psychologist will give you tools that will help you to manage these situations going forward. So whether it's breathing relaxation, whether it's reframing of your thinking patterns and things like that. And then when you're better, you may be seeing all three because your psychiatrist is dealing with your meds, the psychologist is helping with this, and the life coach is helping you to now navigate life going forward, because maybe some major changes have happened and you need to know next steps. Although fairly, we usually recommend that you only see the life coach when you are having mild distress, not major distress. That's helpful.
Okay.
I know it's difficult.
Yeah,
You can't really
yes.
measure. But
okay,
yeah.
so if somebody comes to you, you'd be able to somehow direct them to the right place. If it's not you, would that work?
Yes, I would be able to direct them to the right place because I've had the privilege of being in all three spaces. I'm a life coach. I told you that before I went to uni, I did a Christian counseling course, and then I went and did a psychology master's, and then a master of medicine in psychiatry. So I would be able to direct a person. But essentially, if somebody is well trained, they should be able to direct you. So if I'm a psychologist, I would be able to tell that this person needs a psychiatrist. I would be able to tell that this person needs a life coach. So if somebody is well trained, they should be able to direct you and tell you that, okay, it's not me you're supposed to see, or it is me you're supposed to see.
Okay, since we're coming to an end, we've gone over the hour. I just wanted to ask you a couple of questions. One of the things that's coming out quite a lot these days is learning disorders or developmental disorders with kids, mental developmental disorders. How can you advise parents? Because a number of times, most parents feel like they would have failed if their child isn't just like any other child. So they try as much as possible to make the child fit in with the rest of the kids, try and send them to, the normal school where there's no assistance and that sort of thing. What sort of advice would you give parents who have noticed that there's some challenges with their child, that the child is different?
I think as early as possible, have the child assessed. That will help you to get the right intervention. Not all children need to go in assisted care. Some of them just need assistance while they're in school. Some of them need a talk with the teacher so that the teacher knows how to accommodate this child. Some of them need extra support. Maybe they need to not progress as fast in school because they need to work on some social skills. So the most important thing is let them get an assessment. If you suspect there's something wrong, and the problem is that if you have older people in the family, they'll probably want to, that even so and so was just like this, just leave it. Just a lot of times they're just trying to tell you it's okay. But if it's really okay, you get an assessment and it will be okay.
Yeah. Okay. Somebody here, Chantel, is asking about what other therapy techniques that you use besides is it CBT, cognitive behavioral therapy? And then lastly, there's a lot of good things. People are saying this is a very good discussion. People are very happy about this. Somebody, I think it's Derek, is asking, can isolation impact mental health? So it's about CBT and then isolation.
Yes, isolation can impact mental health, definitely. And that's one of the reasons why you remember when I was talking about the most basic care being social support. So being connected to people, emotional support does a lot for us in terms of recovery. And it has to be good support because some people, there are a lot of negativity. They just worsen our mental health. So yeah, focusing on that. Techniques are plenty, Chantel. There are plenty and more are being discovered right now. Apart from cognitive behavioral therapy, there's what is called ACT therapy. There's what is called trauma release techniques, light therapy. People use music, and they're just some play therapy, depending on what you're doing with the person, psychotherapy, psychoanalytic psychotherapy itself. There's just so many. And I think the most important thing is to have somebody who you've had a good reputation about, because I think people are doing a lot of experiments on people with whatever. I mean, at this point, I feel like everybody's calling themselves a therapist or a counselor. So the most important thing, I think, is to get a good recommendation. And if you can, especially if the person is calling themselves a therapist, find out what their method is, like their style is, their ethos are, so that you can just know if it aligns with who you are and where you want to go.
That should be interesting, because I'm just thinking it's very hard for you to recover if you went to the wrong person. It might be very hard for you to recover. I mean, you might be taking your child to that sort of place. You might be taking your broken marriage to that sort of situation. You might be taking your work stresses to a person like that. And if you get to the wrong person, that might be quite a problematic situation to recover from. It might just make it worse. Yeah.
True. But most people are nice. So
yes,
very few people are out there to manipulate other people, even though they're there. But that is one of the roles of what the Mental Health Council is supposed to do. Regulate such things. Then you can report people who have been doing malpractice. But now that we don't have any regulator, then people can do whatever they want.
Okay, thanks very much. I'll hand over back to Ali. It's been quite an informative discussion, and I can see from the comments that I'm seeing on Facebook and the comments that I'm seeing on the chat here that a lot of people are quite happy with the discussion that we had to have it, and it's been very informative for us. I mean, I've done one psychology course in my whole life, but I came in here as a pure layman. I've learned quite a lot from you, and we just appreciate the time that you've given us. Over to you, Mr. Ali.
All right. Thank you very much, Jonathan. And I must say that you have done justice. Perhaps let me just get to Dr. Maria's page, because I have logged on. Let me read something from Esther Mondoka. This is very insightful. That is Esther. And then there is Chinyanta Chichi Chintompagwalia. Chinyanta is saying this has been a very insightful session. So we can see that from the other side, we have people who have appreciated this conversation. And let me get back into the chat box as well before I ask maybe a last question as well. Very insightful question. Wow, wow, wow. I can say all our praises, very insightful information, always insightful and thought-provoking. And that was someone Josie and someone using a Galaxy, very insightful discussion. Madam Ngabo, she's saying very insight. Thanks a lot, Doctor. Thank you all. Okay, that's from Maria. Dorcas is saying, I have learned a lot. Tino is saying, thank you very much. Oh, there are so many praises down in the chat box. Let me just ask you one last question, and maybe we can call it a day. You promised that maybe along the way you will mention the statistics concerning the rate or the levels of mental health illnesses in Zambia. I come from the Copper Belt where we even call some people environmental. I think where it is, when we say environmental, it means this person is not normal. And in my culture, in my community, like you have cleared now the air, anyone with some mental illnesses, we call very pena, very fulungana, not normal. Thank you very much, but as long as someone has a brain, it is possible to suffer from these mental health issues. Now, do you have any statistics to maybe share with us the rate at where we are when it comes to the mental health challenges in Zambia?
So no, I don't have any statistics. That's why I didn't promise to give you any statistics. We have not had a prevalence study done in Zambia ever. The only projections are mainly from WHO. And one of the things that they talk about is that 1 in 5 people have got depression. 1 in 4 have some kind of a mental illness. So it may not necessarily be depression, but some kind of a mental illness at any given time will have that kind of prevalence. It's also projected by WHO that by 2030, depression will be the leading cause of morbidity in the world. But after COVID, they actually said that they think it will come sooner than 2030 because COVID seemed to have accelerated a lot of mental illnesses. Yeah. So generally, those are the stats for the region. They tend to be higher in places where there's more poverty and more substance use. So they might be higher than that for our region here, but at least you know that those are the stats. And for me, it just shows all the more reason why we should have a service for it. Because can you imagine how many people is that? In our country here in Zambia, 20 million, we're already looking at 4 to 5 million people experiencing those kinds of problems. So the service is needed.
Maybe last question, I think I've just remembered you mentioned that maybe now you give an example where if one is not feeling well at work, that person will be given a leave to go and rest, to have a bed rest. And the person suffering from mental health challenges, that person will not be given. Maybe that time is going through, you mentioned maybe divorce or other social issues. And sometimes where we have worked in some places of work, you could tell that this person is going through some challenges, but they are never given such opportunities unless maybe someone says, I'm not feeling well, and then that's when they will be given that. So now, in your experience, how do you foresee this situation? How do employers go into handling this kind of a situation where maybe the man has been disturbed by the wife, or there is just having some social challenges, people involving in Kalova, involving in other things, but the manifestations are at work, loss of concentration, or someone is just shouting at the subordinate. So how will the employers going to handle, or how are they handling these situations? I think maybe this will be my last question, then we will give some closing remarks. Thank you.
All right. So at Renaissance, where I work, we run a course for managers and leaders called Workplace Care and Culture. And this course, we ended up developing it because a lot of HR people and leaders were coming and saying, look, I was put in this leadership position because of technical support. But now I end up listening to a lot of personal problems and I don't know what to do with them. You know, some people come to me, my mother's died, like, and then they come and say, oh, people at this workplace, they don't care. I told them that this is happening and they really don't know. But also the aim of the course, the idea for the leader is not that they should become a counselor, because that's not what they were employed for. So in that course, we also talk about the boundaries that are important for you to keep, but at the same time, being able to offer that care and support in a way that builds a good workplace culture. Because in modern day times, we cannot run away from that. When we were growing up, people say, keep your personal problems at home. Don't bring them to your workplace. In today's world, with the Gen Zs and the new generation we have, if you don't care about me, I'm not working for you. You can't just talk about me and say, like, those are my issues. You have to be interested in who I am. And then there's a recognition that when I come to work, I'm not just coming with my work person. It's the same person who is at home, who is dealing with debt, who is dealing with all these things. So employers have to find a way to support this person the same way they do with insurance when they give physical health support, or loan schemes when they help employees deal with loans. So I think that what's important in focusing on caring for a person is to recognize that this culture has to change. You can't focus on somebody and just say, no, you're just coming to work. But at the same time, as in any system, there is the risk of abuse. So what I recommend is the same way you do for physical conditions where you go, you should do also if you need mental health support, that you should be able to come back with a note from your psychologist. And if the mental health counsel was there, we would say a licensed psychologist or counselor, so that it's not any Jim and Jack just bringing a note. And I think that at the same time, it's also possible for the HR personnel or the leader to mandate it. Like, look, if your issues are affecting your work, then you should go and get help. Because if you're coming to work, you're sick, you're not able to perform, you would go to the clinic, right? So in the same way, if somebody is having poor concentration because of their issues, let them get help. I hope that answers your question.
Exactly. Thank you very much. As we are winding up, I think, what are your last words or in closing to us online with you and those on Facebook? And those who will watch this video, of course, it was going to be shared on my YouTube channel.
Well, I think firstly that when you pick up your finger to point at someone, when you get up to judge someone, just remember that it could be you. That if you see someone in distress, please reach out to them. They need support. And also, if you yourself are in distress and you need help, please reach out to us. You can reach out to Renaissance. We'll be able to support you. You can inbox me and I'll be able to give you the details and support that you need. If you don't want to reach out to Renaissance, there are other practitioners that you can definitely reach out to. I think I mentioned earlier that I've written a book entitled How Can I Make the Pain Go Away? Please get a copy of the book. It's available in Book World. It's also available in BM bookstores and will soon be available on Amazon. Thank you for listening.
All right. Well, thank you very much, Dr. Maria. I think those who want to reach out to Dr. Maria Akani, you can reach out to Renaissance. They specialize in psychotherapy and counseling and talk therapy, child coaching, and play therapy, psychiatry. I hope I pronounced it well, employee assistance program. I have attended one of these programs where Renaissance visits some companies and they speak to the employees, and they also conduct training and development. And you can reach out, or you can even visit the website where Renaissance, www.renaissance.net, or you can call the numbers which I posted in the chat box and I also shared on the Facebook page. Dr. Maria, our words may not be enough to thank you and to appreciate the time that you have shared with us. We owe you so much, and we are so grateful for spending over an hour. If you had asked us to pay you the value that you have shared with us for an hour, I know elsewhere they pay you so much which we cannot even afford. But we are so grateful for the impact that you have left with us. It will not only end here, but it will last in our lives and our families and our community. And this is what SmartVersity Book Club is all about. We want to inspire change. We want to inspire self-growth. So the mind, which is not balanced mentally or physical health, or just around the holistic approach, we may not achieve and develop. So through reading and through having conversations with experts like you, it brings self-growth. Thank you very much, Dr. Maria, and everyone on the call and those joining us on Facebook. Until next week, we're having a book review on our book club, SmartVersity Book Club. I have not shared a link for those who would want to join our book club. You can inbox me, or you can drop your contact there. We will share the link. You join the unique and the wonderful book club where we just inspire each other for growth. Thank you very much, Dr. Maria, and everyone. Enjoy the evening.
Thank you for having me.
You're welcome. Bye-bye. All right, we are going offline. Thank you. Bye.